This is the big day for me.
So I'm here, getting ready to do all the stuff you have to do before surgery, and nervous.
A lot of things I'm going to have to give up for months, maybe even a year. I wanted to show you this. I had IVs in both of my hands, and that made it so difficult in the hospital to get moving in the bed. Such a relief when I did get that removed.
This is Jedis for Jesus, and we are Bible-believing Christians. And if you want to find the truth, that is where you look. There are so many lies in this world, but we will only tell you the truth here. The evil one is after you, and we here at Jedis for Jesus want to make sure you have a one-way ticket to paradise.
This is me in my room, and I'm going to go ahead and explain some things, what I remember and what I don't remember, and we'll go ahead and do that while I'm at home here, because I took a lot of notes to remember what happened from going into surgery to coming into the recovery room to my room. Still very tired after 4 hours operation and over 2.5 hours recovery. I don't remember too much of the being in the operating room, except for here they put a mask on and then I was breathing. And then the next thing you know it, I'm waking up in the room there. I don't remember recovery, and I don't remember even going up the elevator and into the room.
I'm extremely tired. Had my wife leave. I took a 15-minute nap. I have to pee. It's unusual to use the catheter that's in me right now to actually pee, so I'm gonna give it a shot. Like peeing in your pants. So here we go.
Boy, do I have a story about them taking the catheter out. Stay tuned.
Really hard to pee with this catheter, so attempting, and then I'm so tired I kind of like doze off again, so attempt number 2, 3, here we go. I didn't know every attempt was actually putting liquid into the bag. This is something they don't really tell you about. Let's see if this works. Leaning back a little bit more, and here we go. So I was looking for where the urine would go to, and I actually found the bag. So there's this one tube that goes up, and it goes underneath the blankets, and you know where it goes to. What a weird feeling. Something that I would not want to repeat. Let me say, the first night in the hospital might be the worst, because you're not going to get much sleep. The reasons for that is you have a catheter in. That's a different feeling of its own. To actually pee every time you press down on that area where you press down to pee, it feels like a burning sensation is going through your penis. So that's not comfortable whatsoever. So I went ahead and asked the nurse, after she dumped the bag once, when she came back in, I said, is there any fluids in there? Because it did not feel like anything was coming out. So when she told me, oh yeah, there's plenty of fluids in there. So I knew every time I felt that burning sensation that I was peeing. And then it's just not natural. You just think you're gonna pee in the bed.
If you're here from the first video and you want to see about the spinal fusion that I have from my L5 S1, or if you just happen to be following us, either way, I'm very happy that you're watching this video. October 28th, I had surgery on my lower back, and this is part 2 of it. I'm gonna make as many parts as I need. I'm now in my 5th day from the hospital. Yesterday was actually a week since I had surgery. I did want to make more videos in the hospital. The first couple of hours I didn't have a roommate, and then I was told later on, probably didn't have a roommate for about 4 hours, and I was kind of out of it by then. So what I want to do here is explain a couple of things. I'll go ahead and show you the room that I was in, and like I said, to be respectful, I didn't want to be making a video and talking at the same time, and with all the drugs that I was on and everything, I just thought it would be better to do it this way. So I'm a person that doesn't like to take that many drugs. I have a tendency of totally, I saw a lot of other videos before I actually had my surgery, and some people it went good and other people it went bad. My doctor, very good doctor, highly recommended from a lot of different people. I have not heard a negative word about this man, and I'm so happy that I had the surgery through him. I see him 3 weeks after I had the surgery. So in another 2 weeks I go back to see him, and that'll be the first time since I was driven back from the hospital, that I'm actually going to be in a car. So I'm just taking it easy at home right now. And some of the things that I wanted to mention to you was some of the things that happened in the hospital, and some of the things that what I remember, and wherever on this side or that side, I'll go ahead and maybe put up a video of things that as I'm talking about this. I'm not doing this by script. I'm just, hopefully I'm not going to be rambling. I do have my phone here that I did take notes, and being up the first night, well, first of all, let me start there. I went into surgery. They put my arm straight across, and I was on my back, and all I remember is the doctor, or just, I don't know who it was, it's like just somebody in there, and they put the, whatever you call it, on my nose, and it just said, this is pure oxygen, and just take some normal deep breaths, and or just take normal breaths, you don't have to take deep breaths. So then I went ahead and kept on doing that, and meanwhile, looking around, and they're stretching out my arm, and I just was looking, you know, right and and then left and right and left, and I was just noticing that there was over, you know, a dozen people in there, and I'm thinking, wow, all these people are in here for me, and it's like, is it gonna, you know, when are they gonna tell me that, okay, now we're giving you the stuff to go to sleep, you know, count backwards? Nope, none of that. About 7 hours later, I'm waking up in my room. I don't remember recovery. I don't remember going on the elevator up to the second floor to where my room was. I don't remember them pushing me into my room. All I remember is looking over to my right hand side and seeing my wife sitting there next to me. And then later on she's telling me that I'm just talking to the nurse. I don't remember talking to the nurse. I don't remember saying anything to the nurse. And then it seemed like, I don't know, minutes later, but you know, I'm looking on the wall and it's like, whether I went back to sleep, but then I was told by somebody, and it's like, oh, that's the physical therapist. They wanted me to get up, and I'm like, you know, probably out of it, and I'm thinking, yeah, I remember them telling me I need to get up as soon as, you know, I can and do physical therapy. So it's like, you want to get up? It's like, yeah, I'll get up. So I got up, I took 3 steps to the other bed, and I'm like, and then she goes, you want to do any more? And I go, nope. So we took 3 steps back, got in the bed, and that was it. You know, that was my physical therapy for the day. I got up. So, you know, I'm sitting here right now doing this, and yeah, I got pain. I got pain. You know, you don't expect to have an operation and 5 days being home after recovery, and then 8 days after surgery to, oh, you don't have pain anymore. You're definitely going to have pain, and you might even have the same pain or more pain, the pain you had before plus more. So what they did, and again, you'll see the pictures, they sliced me in the front, and not sure because it's all bandaged up, and so I haven't seen the incision in the front, and I haven't seen the incision in the back. So I had my wife take these pictures, and the one in the front really is weird. And then I was reading up about it. It's like, how long would it take? It says 6 to 8 weeks, and they mentioned something about tummy tuck, and I'm thinking, to have that pain, I would never get a tummy tuck, let me tell you that. Or just to get cut in the front, you can't chuckle, it hurts. You can't take very deep breaths. When they tell you to take deep breaths, it hurts. When you cough, you don't want to cough, it hurts. Then just think about getting in and out of bed. In the beginning, I had a catheter. That's, I explained that in this video. And I don't ever want to have one of those again in my life. That's just not natural. To put something down there and then, you know, when they say if when you pee you burn down, then you have some kind of, you know, disease, you know, you gotta take medicine for that. So it's like, no, that's the kind of burn that as you're peeing into the catheter, that doesn't go away, and then when they finally do take that thing out, that's not a pleasant feeling. And then that burning sensation the first time you pee, that's not pleasurable. And I just never again. I don't want that. so many things in this surgery. Never again. I don't want that. I did have shoulder surgery. I got a little bit of video footage of that. I was going to try to put something together about that. Knowing that 4 months into having shoulder surgery and doing your PT, and that is painful. But now being 8 days after operation with this surgery, and knowing that it's the physical therapist part right now is like, that's not as painful as the shoulder surgery, but everything else, the just simple things, getting in and out of your bed, in the middle of the night you gotta pee, getting out of bed, do it safely. And one thing you don't want to do, it's like, oh, I fell last night. You don't want to fall. You don't want to fall at all. You'll see maybe that I'll show you the walker that they gave me, and I can actually walk around without it, but if you fall, you're going to the hospital. Now, normal people, you're walking around, you fall, you're not going to the hospital. You know, you got maybe have bruise or so. I take it seriously. I'm, like I said, 5 days home, I'm still using my walker. I'll probably use my walker when I go see the doctor 3 weeks out from surgery. I'm gonna go ahead and use my walker to go see the doctor, just to be on the safe side. I don't want to fall. I don't want the doctor or anybody telling me that it's like, you didn't listen to us and it's your fault, and that's why you didn't heal the way you should have healed.
If you got any value out of this video, please like, subscribe, and hit the bell to be notified when we upload a brand new video. Thank you.
I got chronic back pain when I turned 40. I got this chronic back pain, and it's gone on since today. And I had surgery 11 years ago, and that was basically, usually when I tell people a leptodectomy, and I might not say it right, scraping of the bone so it won't be touching the nerve. Well, that is the thing that collapsed, and that is where my nerves were being disturbed again, and that part collapsed. So that was my L5, S1, and now they put in a couple of pins. They put the spacer, and my doctor put the biggest spacer he could in, and you go through the front to put the spacer in, and then he makes the incision in the back to go ahead and put the rod and screws in. So that eventually is going to take 6 months to a year to fuse together. So I got to be careful, 6 months out, and then they recommend you're not going to go back to jogging or I don't know, whatever that would be considered a little bit more extreme. Then you just have to take it easy. So until next November 2025, no major craziness that I can do. It's like a little bit at a time. Exercise, physical therapy, and then exercise after walking is so important. Let me go back to the hospital, and what I really recommend is, like I said, I got my notes here on the phone that I took in the hospital, and I'm going to go ahead and go through those. So you're probably wondering what this strap might be. It's my little friend. No, not that little friend up here, but my little friend that I gotta have around me all the time. And here's this little tube right here. So this is sucks to moisture. I got this bandage around me, as you can see, that picture up there. And it just makes sure that if there's an infection or anything like that and there's moisture, this guy just sucks it out. And on the bottom there's a reserve, but it's like there's really not that much liquid in there, so I think I'm doing good, and I'm not going to have that problem. So let me go ahead and I did mention that I had a roommate, and the roommate that I did have, it's like, here it is, first night, you know, with being out for the surgery, and you know, probably 7 hours of sleep already. I had a roommate that had a cough. They didn't know what it was from, valley fever, pneumonia, and he was a nice guy. I don't know, within the first hour of in the room, he apologized for his cough, and you know, I was gracious back and said, you know, that's okay, you know, you just have to get better. We both do. And I just told him, it's like, you know, all the other stuff, all the other noises that are going on in the hospital, you know, that's gonna keep you awake. So when the nurse would come in every once in a while, I'd be on my phone, and at around midnight, she said, you better get some sleep, because tomorrow you will have a headache because of the medication you are on. And I was like, oh, I don't want that, even though, you know, I slept 7 hours in surgery, if you consider that sleep. And but so at that point I was thinking, how the heck am I going to get any sleep? It's I'm in pain, there's a lot of noise. So I said, okay, there's this app that I downloaded a long time ago on my phone. It's called White Noise, and I had earbuds that I brought from home. So what I wound up doing was I went through the White Noise, what was the best. You know, they got ocean sound, they got rain and stuff like that, or a river. So I went ahead, at times I like the rain sound without the thunder and lightning. And so I picked that, and it's weird, I could still hear the sound, but I did go to sleep. I usually would sleep about 2 hours, and the other thing too is my earbuds would only last 2 hours, and they would start beeping, that low battery. So at that point, then I had to charge them, and that didn't take long, and then I got another 2 hours of sleep. So I highly recommend getting that on your phone. If you're going anytime soon in the hospital, you want to get some sleep, that was good. And then, you know, I don't know, I put down here that best time to get sleep for me in the hospital was lights are out about 9:30. They didn't come in again until 12:15, and that was, you know, like I said, after that I knew that it's like at 9:30 I'm going to put the lights out and try to get some sleep at that point, because they come in at 12, and then they'll come in again at maybe sometimes 2, and if you're lucky don't come in until 4. They're taking your blood pressure, they're taking your temperature, and then somebody, you know, every morning comes in about 4 or 5 o'clock. Usually for me it was 5 o'clock to take some blood. And you know, this is how my hands looked, you know, both of them. I had those in, and that was one good thing about the catheter, is I didn't have to get out of bed to go pee every, you know, whatever amount of time. They did disconnect me from the fluids, so whatever kind of fluids I was getting now was, you know, me consuming them through my mouth. So I usually love drinking water. It's very difficult for me as we're making this video right now. It's just everything from eating, breathing, you feel it in your gut. And probably eating half of what I used to eat, and it just, am I hungry? No. You don't know if you want to poop, eat, or cry. Sometimes it's like, you know, you wonder if it's the muscles contracting because you know, so the pain, it's growing back. It's like, so the second day, 4 a.m. in the morning, at this point it's like, you know, I only walked you know, like 3 steps and 3 steps back, and I got back in bed. So at 4 a.m. somebody asked me if I wanted to walk, and I'm thinking, sure, you know, what do I do? How do I get out of bed? You know, they told me, you know, when I was still out of it, you know, how to do this or how to get out of bed, but I don't remember. I was, you know, half asleep. You know, as it got later in that day, well, before my wife left around 4:30, being there since 6 o'clock in the morning, then she left at 4:30. It's like, yeah, you know, I was, you know, a little bit more in my right mind and not under, you know, the drugs and all that. So when they came in at 4 a.m. and they said, you know, would you like to go for a walk? And it's like, yeah, I need help, you know, show me how to get out of this bed. And so we walked down the hallway, and it's like, okay, how far am I supposed to walk? And it's like, are you hurting? I go, yeah, you know, I was hurting halfway through the walk already. So she goes, okay, we could turn around and go back, and did that. And so that was my first walk 18 hours after surgery. So I did mention about the pain that you have in your stomach and stuff like that, and they put the tube in surgery down your throat, and it didn't, thank God I didn't have that irritation, because I remember that in another surgery I did. You might have the cough then. I still, when I'm listening to my voice and stuff like that, I know it's got a rasp in it and it sounds a little bit different. So if you've seen other videos and you're watching this one, you might say, oh yeah, I do notice that. So that might be another reason why you're going to be coughing. And like I said, that's going to really hurt your gut when you do. And you know, what are you supposed to do? That's just part of the healing process. So what I normally do, the best thing for me to have less pain is, like, I'll put my hand over my area where I had my incision down, you know, down below here. And when I do have to cough or move or something like that, it's like, if I don't need both hands, it's like I put one hand there and put slight pressure on it. Just, I don't know, it just makes it feel a little bit better. I'm going to do my very best to go ahead and put more videos out there to let you know, like some of the videos that I saw. Just for example, there's this guy that had the surgery, and he was 7 days out towards the end, and you know, the guy was walking around, you know, with his phone, you know, like this, recording himself. And I'd be like, if he falls, or that's taking a risk. And then in his comments he had an update that he wasn't doing too good. And I'm just thinking, yeah, I could see why maybe you weren't doing too good, because they're telling me to use that walker that I got right over there on the other side of the camera. And there's not too much you should do too long. So, you know, you got to get up in the middle of the night to go to the bathroom. Well, you might have slept 2-3 hours and you got to get up. It's good to get up. It's not good to lay down for too long. It's not good to sit for too long in one position. It's not good to be standing too long. So The most that maybe I sit down on the couch, that's the most comfortable area where I could sit, is maybe about 2 hours, and then I get up. Whether it's just to get up, and then at that time I might have to go to the bathroom, but then walking around, try to walk around the house a little bit. If you have a place outside, like in the backyard, and you can walk with your walker. Because like I said, you want to make sure you do everything correctly. So somebody can't point their finger at you and say, well, it's because of what you didn't do. And it's a good thing that I got a stubborn streak in me. It's like, doctor tells me, you got to do physical therapy 4 times a day. Well, I'm not going to do it 4 times a day. I'm going to do it 2, but at least I do it 2 times. So, with the physical therapy for my shoulder, and they say, you wouldn't be able to do this with your right arm if you don't do the physical therapy. So I did the physical therapy. And both of my arms, I can do that. So, right now I do that. Do I feel, any pain? No, I don't. If I didn't mention this, 57 years old. I've been a truck driver since I've been 19 years old. I didn't have the semi truck driving job when I turned 19, but I have been driving since I was 17 years old. So that's 40 years that I've been a driver. And the last 24 years I've driven for the same company and retired with them with a pension. So I just and have been told that it's like, no, it wouldn't be a good idea for you to go back to being a truck driver because already having a surgery 11 years ago and having a surgery again. So, and it's because of, for me, truck driving made me have another surgery, and I need to stay away from that. So again, if you're watching this, thank you. If you're watching this because you want to know what it is to see somebody that is going to be telling you the truth and letting you know how the surgery went, this is a week out. Eventually I'll be making a video saying this is 6 months out, 9 months out, a year out, and I'll let you know how I feel this time next year. And to tell you the truth, the main reason that I got this surgery is because there'd be nights I'd lay down in my bed and I wouldn't go to sleep for hours. And don't like taking medication, Advil, Aleve, Tylenol, whatever. They didn't help, so why am I taking them? Eat properly, exercise. That's the best thing to do. And it's like, and if you don't get the vitamins that you need, supplements, and you always got to put this in here too. It's like, I'm not giving you any medical advice. I'm not a doctor. I'm just giving you what I've been through and what I'm going through. So all the drugs that I do take, it's like Hydrocodone, that didn't help me go to sleep. I took a muscle relaxer, and I'm not going to go ahead and say the name or anything like that or how many milligrams or whatever. I'm going to have it down in the description on what pills I took to go to sleep. I can tell you I take a melatonin, that's over the counter, you can get that. That helps me. And what I take for the muscle relaxer, that helped me go to sleep. But I know the Hydrocodone, that didn't help me go to sleep, but when I came out of surgery and stuff like that and had that, I was on 10 milligrams of that, and then I was also on 5 milligrams of volume. And they gave me that for the first few nights, and then just Hydrocodone, and then now I'm only on, I take half of the muscle relaxer and melatonin to get to sleep, and then I go ahead and take in the middle of the night when I get up to go pee, I go ahead and take a half of Hydrocodone, which would be it's 10 milligram pill. I cut it in half, so it's 5 milligrams, and that's all I take in a 24-hour period. So right now my pain level sitting here making this video is about a 7. So, you know, I gotta hit stop on this record button, and then I'm gonna have to get up and walk and take it easy. But sometimes if I'm making a face or something like that, it's well, might be trying to get my thoughts together, but also it's the pain.
This is Jedis for Jesus. Hope to see you one day soon in heaven.